Studios. Glad you could join us. Welcome to the program.
Thank you for having me. It's a pleasure to be here once again. Thank you.
Dr. Paul, I'd like to begin with your experience during the meningitis outbreak. What challenges existed at that time?
Yeah, we have a lot of challenges during 2017 meningitis outbreak. That was the largest outbreak Nigeria has ever reported in terms of meningitis. And of course, it was so much that it was spread from northwest zone of the country down to north central. But of course, when we see that, having identified the index case, we were able to know that we need to move into action by developing a micro plan with our team. The basic challenges that we have in those times was that there were a lot of treatment plan, a lot of treatment protocols existing. And of course, in terms of drugs that are available at different health centers where people are using to manage some of this COVID-19 of standard, they were not really of quality standard. So that posed a lot of challenges for us. And of course, it was a little bit difficult to compare that with what we have with COVID-19, though a lot of similarity exists. But of course, we were able to manage that through a robust system. Then I was the medical team leader for Medicines Sans Frontières then, and worked closely with the CDC, WHO, and UNICEF then to come up, using different EOC meetings to plan how to really attack that. So the challenges that we actually have those time, number one, has to do with the quality of the drugs available, and of course we talk about contact tracing was purely funded by the donor. And of course, we have the support of the government sitting on the driver's seat. But in terms of funding, the funding was actually by donor fund, donor driven. So, and that was actually what happened during those periods. So,
Dr. Paul,
the challenges ranges from the cases were scattered, they were not nucleated, they are not easily seen. And those are the things that we do. Yeah.
Compared to what we're facing now, and this is the COVID-19 pandemic, what are we learning as to how to reduce our numbers and stop any wave or second wave of the virus?
Yeah, one of the things that we need to do is to know the quality of the medication that is being given to some of these people, especially people that have comorbidity, because these are the people that accounted for over 50% of death that we have. And because this was one of the major challenges that we have then, and this was we were able to address that by ensuring that the quality of medicine given to these people were actually of high quality. And number two, the contact tracing need to be properly done. Then we have the air promoters team, which are people that have a strong competency, people that have been well trained on how to do contact tracing, case management. Of course, a lot of our treatment centers then in northwest zone of the country. I think these are the things that we can actually bring in to look at how can we sincerely ensure that we have a quality contact tracing, a quality case management, and all the treatment protocols are regulated. We follow the same standard, and there is a quality information, because I see a lot of communication gap existing. People will tell you they don't believe that COVID-19 is existing. Somebody can tell you how many figures, those figures are political, and a lot of things are. So people actually have to also see. And one of the things that helped us then was that we're able to work with the community leaders, we work with the government, we engage the religious leader. We have a lot of messages interpreted in different ways by which the target audience could also be easily hit. So, and that actually produced the magic that we did in 2017. I think this also is still lacking. People want to see, when you say you have a COVID-19 patient dying, they want to see that. During our period, people have seen people dying of meningitis, see children or the age, adults, people coming down with. So these are the things that we need to really come together to see, to actually address in terms of a lesson learned that could be applicable here in a sincere manner.
All right, we'd like to appreciate your time. Thank you so much, Dr. Abiodun Paul, medical laboratory scientist, public health expert. Thank you for joining us on the program. South